Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. We'll talk with experts on a wide range of topics, including nutrition, stress relief, sleep, mental health, etc.
And we'll dig into the issues that can cause fertility challenges, like PCOS, or early menopause, or cancer treatment.
So if you're curious about your fertility, whether you're ready to start a family,
or you're preserving your options for the future, let's dig in. Welcome back to The Whole Pineapple. I'm Ruby Boris.
I'm Ann Judge.
And the stars have aligned.
Yay!
I'm so excited for our guest today. We are kind of changing gears, and we are talking about the sperm side of things.
Finally.
Yes, it's about time. And, you know, it's funny because I was just thinking today, I don't know what made me think about this, but if you had to pick a cell, a human cell in the body, which one do you think is like the coolest one?
I mean, I would say the egg. I'm biased.
Yeah,
but sperm are cool too. You know?
Sperm are so cool.
They're just a bit more
disposable.
There's so many of them.
There's a lot, right? Yes. Yeah, the eggs are pretty amazing because there's only one of them and they have to travel. But think about the process of the sperm trying to get to its destination. It's like they're very persistent little things. Well, we are super happy to welcome Dr. Marah Hehemann. She is a fellowship trained surgeon, researcher, educator, and patient advocate specializing in the field of urologic, reproductive, and sexual health. She is an assistant professor of urology at the University of Washington. She graduated with distinction from the University of Michigan with degrees in both biology and art history. Ooh. She then earned a medical degree from Rush Medical College in Chicago and completed her general and urologic surgical training at Loyola. I can never say that. Loyola University Medical Center. And she completed a fellowship in andrology, male reproductive, and sexual health at the University of Washington. She's an active member of several national and international societies, and she's just a pretty cool, awesome person. So welcome to the show, Marah.
Hi, Ruby. Hi, Ann. Thank you so much for having me. It is a joy to be with you today. And I do think sperm are very interesting, clearly. So we'll have lots to talk about.
Oh, that's often one of my first questions is like, what drew you to this field? Because I feel like, you know, sometimes people get more questions if they specialize in an area of the body that they may not personally possess. So what made you decide to study more of this urologic health, and what took you down that path from art history to testicles?
The art history background is just that my parents are both artists, but no, specifically about the field. I got a random summer job after my freshman year of college, and it happened to be with a urologist who specialized in sexual health on the male side of things, really mostly penile reconstruction, and did some fertility work as well. And it sort of sparked an interest in me. I knew I wanted to be a surgeon, and the procedures that I do are super interesting. And then really it's the patient care that drew me into this field, the discussions that I get to have about really high sensitivity topics like fertility preservation, infertility, sexual wellness, transgender care. You know, all of these things are really high level EQ type of things that we need to talk about. And it's really fulfilling job in that way.
You definitely need to have that skill set. You know, it's different talking to someone about their sexual health than it is talking about their diabetes management or hypertension. Like I see you have to have really tough discussions where it probably takes people a little bit of time to warm up and feel comfortable really kind of going through the full area of their concerns with you. That's really a tough and very important aspect to this job.
Yeah, I mean, you both know it very well as well on the other side of things. They can be really tough conversations. They can be really joyful conversations. But, you know, being a supportive partner to patients is always important.
And I feel like the stress on the side of what tends to be more the partner side, those with sperm, it doesn't get enough attention. I feel like we do talk a lot about the stress and the emotional needs of the person producing eggs, especially because so much of fertility treatment is more invasive related to that person's role in it. And so sometimes I think I mean, this episode is our small entry into that, really realizing that the sperm side is, in many studies, about 40% of what's going on when they have a couple that isn't conceiving. And we should talk about all aspects of it more than we really do.
Absolutely. What we always tell folks is that 50% of the time there is a sperm factor involved. So
wow.
Whether it is solely a testicle or sperm production problem, or, on that side of things, or just a combination with the egg side of things, there's 50% of the time it's involved. So really begs the question why society has such a, kind of obsession with that. It's really just an egg problem or a female problem, where both partners should be evaluated and both partners really ought to be sort of optimized.
And I feel like there probably was actually more attention to this back before we had IVF, when you were just working with the sperm you were working with. And then I think there was more of an impact or an emphasis on lifestyle and how do you maximize the potential of the sperm that you do have. But once you had the ability to put sperm and egg directly in a dish, and then with the development of ICSI, pick like a single good looking sperm and just inject it to the egg, I feel like all focus on anything else you could be doing for sperm health really got the back burner. It was like, well, then we'll just do IVF and bypass everything. But that's not really the case. I think we're learning a lot more now about how even in the setting of IVF, there are definitely a lot of things we can do to improve the overall quality and success rates with sperm.
Absolutely. We know that there are things we can do as urologists to improve the DNA of sperm and even improve IVF outcomes, even if couples are using IVF. So definitely still a very important part of the equation, even in the era of IVF ICSI. Sometimes there aren't many redundant sperms. Sometimes there is just one, and we need to make sure it's functioning as well as possible.
It's interesting because, we spend a lot of time, at least I do, talking about lifestyle with my patients with eggs and how that impacts fertility. I get a lot of questions for them about what can I do with my lifestyle to optimize things. But it's much more rare that we talk about the sperm side of things. Occasionally it comes up when I'm doing the phone calls talking to patients who just did a semen analysis and they're like, what can I do to boost my numbers? That's where it really is an entry point to talk about lifestyle stuff. But other than that, I feel like we don't talk about it as much with the sperm side.
Yeah. So when you're seeing some for the first time, like take us through what you do. Like what are the questions that you're asking? Like how do you kind of get that conversation going to really understand what's happening?
Yeah, I mean, it's not a scary doctor's visit. It's just taking basic questions about your history, reproductive history, meaning, how long have you been trying? Of course, all the questions that one would expect to be asked at talking about reproduction and fertility. And then going back into any surgical history, any medications, any history of use of chemotherapy, testosterone, things like that may impact sperm production. In the era of COVID, you may not even receive a physical exam by me if you are getting an evaluation. Sometimes we rely on the use of ultrasounds of the testicles to best evaluate them in place of doing a physical exam. So that is, those are sort of the initial elements, are a history and a physical exam if able. And then truly the cornerstone of sperm testing is with a semen analysis. So that's really going to test testicle owners in terms of where they're at for fertility. A semen analysis is best done on site if able. From kind of a anxiety perspective, we do like to do it in the office if possible. Just provides the best outcomes. I like to have 2 samples, and many folks will ask, why do I need to do 2 of these uncomfortable tests? Well, the semen quality can vary a lot from day to day. And so if there are any abnormalities that we find, we want to see if there are consistency in those abnormalities. And that would determine further testing, like the need for blood tests or the need for that ultrasound that I mentioned. But really the beginning test is just the semen analysis.
How long do you like between the first and the second sample?
Ideally about 2 weeks between the first and the second sample. And in terms of abstinence of ejaculation before the samples, the ideal window is about 2 to 5 days.
Yeah, so the semen analysis is just one snapshot in time. So it really doesn't give you the full picture. So I know we have a lot of patients that come in and do a semen analysis, and I'll call them with the results and talk to them and say like, okay, yes, there's some abnormalities here. Oftentimes what I'm saying is like, yes, we can refer you to a urologist, but they'll probably want you to repeat this before your next visit just to have a full complete picture if this is something that's persistent, or if it's something that was just maybe a one-off kind of thing. But certainly we understand that it's not, one, semen analysis is probably uncomfortable enough, but two, it just gives us a lot of good information.
Absolutely. Yeah.
And we do try and make it as least scary as we can. You know, as you said, we try to have people ideally collect in clinic, and we have private rooms and visual aids and soundproofing. And if people still really don't think they can collect in clinic, people can do what's called a home collection. We can give you a home collect kit that has the instructions, and you can bring that sample into us in a set window of time. So I know sometimes people are hesitant to tell us if the reason they haven't done an analysis isn't because they've just been busy, but because they're really quite anxious about it or not sure they're going to be able to collect in office. And if you talk with us about what's going on, we can usually find some way to make it a little bit easier and a little bit less intimidating.
Well, how many times have you heard a partner saying like, well, they just have to do, a collection. I have to do all these invasive things. So like, yes, you do have to do like lots of tests on uterus and fallopian tubes and things like that. But a semen analysis is not a comfortable, it's not in your natural environment. I should say that. So it certainly is not anything anybody wants to do, but we do try our best. And just to know, like in the clinic, like, we are totally used to this.
Yeah.
Like there's, so it is very regimented and routine for us, but we understand that it's uncomfortable for you too.
Yeah, that's a great point. We don't want to minimize how impactful that can be for some folks.
And it can, I think people are really nervous about what the results are going to show. I think there's kind of this cultural expectations and like, oh, a high sperm count is associated with like virility. And I feel like people maybe do feel a little bit more personally invested in what their sperm count is going to be like, but I don't necessarily see that on the same side. When people find out they have a lower egg supply, they're often upset for many reasons, but I don't usually see quite the same sense of like shocking sense of self that I sometimes think when people find out they do have a low sperm count, even though, I mean, there are so many reasons, and most of the time we honestly don't know why a count is low, right?
Yeah, I mean, there are certainly a finite number of things that we can find out about hormones or about anatomy that may predict lower counts or maybe things that we can fix. But I will say that sperm research is newer than egg research, and there's a lot we're going to learn probably in the next 5 to 10 years about genetics and, where we can really change the game for sperm and for testicle owners in terms of fertility.
It's so surprising to me that it is so new because it's so accessible compared to eggs, like,
Well, I was going to say, yeah, and in the spectrum of fertility treatment, people were doing inseminations with donor sperm well before, IVF or any of the experience we were doing with eggs. Like people have known for quite a long time that sometimes you need sperm from another source to cause a pregnancy. And of course, in the olden days, it was all very poorly done and unregulated. and it's very different than with the donor sperm banks we have right now. But it's something that there has been a lot of study on, but just not in the same detail. And I think you're right. There's a lot more that hopefully we will understand in the next decade. But if you're trying to hopefully not wait a decade to get pregnant, we're kind of limited with the things that we have right now.
Yeah, but certainly we offer lots of information. And, just to get back a little bit to that lifestyle piece, there are some great studies on lifestyle. And something that I definitely talk to men about, even if we can't find a specific cause for fertility challenges or, sperm abnormalities. So some of the things we talk about are, my basic general recommendations are that anything that you do that's good for your heart is good for fertility. And I think that probably goes for both sperm owners and egg producers and on either side. So, exercising regularly, just moderate amount of exercise, 5 days a week, 30 minutes a day. Eating a healthy diet, really Mediterranean diet is kind of the go-to for both sperm health, for penile health, kind of in everything that I do. weight loss, reducing sedentary activity, stress reduction. I know you guys probably talk a lot with your patients about trying to manage the stress of fertility, right?
Mm-hmm. And you're right. We often don't talk about it enough for people on the sperm side, but we really should because that process is really stressful too.
Yeah, there have been some studies that show that infertility is a predictor of more infertility just due to the stress of all the treatments and testing, and of course financial contributions. So yeah, it's a part of it.
And then also on the nutrition side of things, so if we're eating a whole food plant-based, like lots of fruits and vegetables, whole grains, things like that, talk about how that impacts blood flow and how that can basically, like you said, it is whatever is good for the heart is good for the penis and the blood vessels and things like that. So how can that affect both fertility and sexual health?
There have actually been studies out of Italy that have randomized men to moderate exercise regimens versus just kind of standard care back to, your day-to-day lack of exercise. And they have seen that erectile function is better in the population who are exercising. So we know that the arteries to the penis are very tiny and are some of the first arteries in the body that can be affected by things like atherosclerosis or sort of vascular disease. That means that erectile dysfunction can be a hallmark of, or the beginning phases of, more sort of systemic or full body vascular disease. Things like high blood pressure, diabetes, high cholesterol, of course, obesity, smoking, tobacco, those are all very high risk factors for vascular disease. And the penis may be one of the first things affected. So really capitalizing on the Mediterranean diet, whole grains, whole vegetables, and smoking cessation, exercise that can impact erectile function. And there are, of course, studies on the same topics in sperm research and fertility research, and we see similar beneficial effects.
Yeah, so there are different causes of erectile dysfunction, but it can be like the canary in the coal mine kind of thing, just giving you a hint into your vascular health. And I don't know, have you seen the documentary Game Changers before?
I have, yes.
With that,
I haven't seen it. What's Game Changers?
Yeah, so Game Changers is it talks about being plant-based athlete primarily, and they have these, I can't remember if they're football players or basketball, I think they're football players. But they had, I think, 3 football players, and they did one night where they had like an animal product based burrito, like, or one had chicken, one had beef, something like that. And they had this little device that went around the penis and could tell like how many more erections they had, the length, the amount of time that they've had erections, and the girth, the strength, like all of that, and compared it to the next day or whatever they did. It was plant-based burritos, and like it was markedly different. Of course, these are 3 football players, of course, but it was just,
so now they're going to sell like erection boosting burritos is basically what you're saying. Like your
yeah, so basically it was like,
Powered by Plants has a very
Powered
different...
by Plants. Powered by Plants. But apparently all the crew that were working on the Game Changers documentary like switched over to plant-based that day after they had filmed that part of the documentary. Very funny. But
it's such a good thing to bring up because there is a lot of overlap with people having erectile dysfunction as part of that journey of infertility. And sometimes it is more related to the stress and the psycho aspect of it because it becomes really stressful. And in the beginning, sex is often about fun and connection and a way of being in that relationship. And then by the time people are potentially having a workup and in the clinic, many times sex has now become an act of stress. It's something that's done on a schedule. It's something that people are anxious about the results. And often that's definitely a very contributory factor to having some issues with erectile dysfunction, but there can also be those biological causes as well. And that does have all these implications for long-term health. So we don't want to brush something off and just be like, well, it's because of the stress of the process. That's why it's so important to, bring up to your providers if this is something that's going on. And often we're going to want you to see your urologist so we can really talk in more detail and not miss something that can really have a lot of overall health implications.
Yeah, I think that's something that comes up in my practice on the fertility side for sure, but also just my more general penile health practice is erectile dysfunction in young men, and why does that happen? You're absolutely right that we don't want to brush it off as something that's just a kind of a psychogenic cause. It certainly can be an early marker of heart disease, especially in folks with risk factors or family history, and evaluation is definitely warranted. If we don't find any major risk factors, and we do think it's more related to sort of stress, I think it's really important to understand that it's not something that's sort of all in a penis, someone with a penis in their head. It's really the nervous system of the body. So
Erections are so complicated. Like
They really are.
Popular culture makes it sound like it's just this instant thought erection, but there are so many systems working to make this happen.
And that's another thing that, like Hollywood shows and movies and things make it seem like you should go from 0 to 60 immediately.
Yeah, and I like to remind folks that, in porn, those guys are using performance enhancing drugs, right? So they're not supermen. They're not that's not normal by any stretch of the imagination. And so the nervous system is really a powerful part of the equation. The sympathetic nervous system is sort of our fight and flight reaction. And when you're stressed out about being on time with ovulation and getting home and getting it done, and that is sort of the anti-Viagra, if you will. It's going to be a boner killer for sure. And meanwhile, the relaxation system, the parasympathetic nervous system, is responsible for erection. So really you need to be in a state of relaxation to capitalize on a good erectile quality. And that's a difficult balance that, especially in the realm of trying to conceive, and you've been trying for months and there's really a lot riding on every time. So we can help. And I think even just kind of understanding how much stress impacts erectile quality is kind of helpful for some folks.
Well, it's such a perfect store because, like, if you're having a problem, you also have a partner who's probably not in their most sympathetic state because they're kind of like, seriously, like, I'm ovulating. Can we get this done? Like, it's not, everybody is not coming to it as their best selves in terms of being patient and being relaxed and, understanding that this is something that can very commonly happen. So often, you probably, if you're on the other side with a partner who's experiencing ED, like in any other situation, you'd probably be really sympathetic. But in that moment, that's probably not your first response either, which is too bad. And then it becomes a very bad feedback loop.
Yeah, I absolutely agree. I've definitely seen that happen.
Yeah, and it goes back to that fight or flight system too, because that's adrenaline, your stress goes up, cortisol goes up, and those things, they cause vasoconstriction. So that also decreases blood flow to the penis, and it's out of your control at that point. Stress is just going to make it more difficult. So it's not something that you can really turn a switch on and off.
So what are you usually doing in terms of treatment? Are you often combining medications with like referrals out for therapy, or what's kind of your approach when someone is struggling with some ED issues?
Yeah, I mean, I think the first thing is the education piece. So just having that conversation about the normalcy of experiencing erectile dysfunction, especially in high stress times like fertility or trying to conceive periods. That's the first piece for sure. I think making sure that everything else from that vascular aspect and risk factors are as safe as possible is the second piece. And then, we do treat with referrals to sex therapy. I have a list of great podcasts that I refer people to listen to, just so they can just hear about how common erectile dysfunction can be and sort of the factors that lead to that. And they can just kind of consume that on their own time without having to talk with anyone about it. That's a really nice resource for people. And then, of course, sex
very
therapy.
Accessible. Podcasts are very accessible.
Yeah, everyone should listen to podcasts.
Absolutely.
Absolutely. Sex therapy, there are some really great websites that we refer to. And then, of course, yes, I do think medications are warranted and are very, very safe in the majority of people. So medications like generic Viagra, generic Cialis, some of them can just be taken daily and you don't really have to think about it. Some are taken more on demand. So may require a little bit more timing and thinking about taking it with food versus not. So, and your urologist will be able to talk to you about all that.
And it is important to make sure that you're taking it safely. I know a lot of people can just order whatever off the internet now, but that's not the best way to get these kind of medications. Even if you're a little shy talking about it, you do want to make sure that there's not anything else going on in your health that could make you not need to take a specific kind of drug. So please talk to a doctor and don't just have someone randomly send it to you in the mail.
Agree.
Little PSA there. Well, because I've had people who are like, oh, well, I am taking it. It's like, oh, who are you seeing? Like, oh, I just got it from somewhere. It's like, well, I would prefer you see one of our providers. So
yes. And the other one that comes up too, that's very, I haven't seen it as much. I feel like the conversation around it is starting to include fertility, is testosterone. There for a while, I was getting so many semen analysis with azoospermia, meaning no sperm. And I'm like, oh yeah, I started testosterone 6 months to a year ago. I've been trying to conceive for a year and a half. And it's like, did they not talk to you about the side effect of testosterone?
So yeah, walk us through this. Explain to us how that pathway works and the testicles and testosterone and what low T versus treatment, like kind of break it down for our listeners. Why you shouldn't be giving your body extra testosterone when you're trying to get pregnant.
Yeah, this is a PSA I'd love to shout from the rooftops.
Yep, you and me both.
Testosterone supplementation, meaning not just the boosters that you may see kind of over the counter in powder form, at GNC.
Like the supplements.
Those are usually fine, but I mean actually taking testosterone injections or gels. These are going to shut down sperm production no matter what. So I think there's a common misconception that giving more testosterone will help with sperm production, but it actually does exactly the opposite. It completely shuts it down. And the reason why is because the testicles rely on a message from the pituitary gland, which is a small organ that's at the base of the brain, and it sends two messages to the testicles. One is to make testosterone, and one is to make sperm. It does a lot of other things, of course, but those are kind of to just distill it down into the simplest thing about the relationship with the testicles. The body's own testosterone around the testicles then also encourages and is required for sperm production. And when a guy takes testosterone, that actually shuts down the messaging from the pituitary gland entirely. And so the body thinks it has enough testosterone, and so it shuts down its own production and also shuts down sperm production. And it happens very rapidly. Luckily, it can be reversed. It just may take time, and that time to regain sperm production is largely based on how long someone has been on the testosterone and how old they are. We think those are the major predicting factors. So if you are someone who's been taking testosterone and you're interested in getting your partner pregnant, certainly I would advise you find a reproductive urologist who knows the safe regimens to get you off testosterone and get you feeling good and making sperm again.
And in fact, the research they're doing right now on contraceptives on the sperm side, they're using testosterone, right? They're trying to figure out what's the right formula for you to be using testosterone as a contraceptive to shut down your sperm production, but still be able to have it reversed when desired. Is that right?
That is exactly right. And it is a good form of contraception, but just getting the right dosing and so there aren't side effects and risks and things like that is the harder piece.
Yeah, but we may be needing some more birth control methods, contraceptive methods on that side sooner rather than later, I'm thinking. So hopefully that research is ongoing and we'll make breakthrough soon.
Yeah.
Well, that brings up for me, like, why is there so much less research on the sort of sperm health side compared to everything? I feel like it's such an undervalued area of medicine for something that
here we go into health anthropology again.
Yeah, I guess so. But...
Yeah, that's a great question. I think it may come down to advocacy. I think it may come down to funding. Even our governing body of fertility, which is the American Society of Reproductive Medicine, when I go to the national meetings, the sperm research side of things is probably about 5% of that entire meeting. So,
So crazy for something that's 40 to 50% of the.
Exactly. Yeah. It's really disproportionate. So, I think it's incumbent upon us to keep talking about it, to have these kind of podcasts, to raise awareness. We do, I'm a part of a few different advocacy groups here in town, in Seattle, and we can always do more, of course.
And I know we talked a lot about ED. I wanted to also bring up premature ejaculation, because I think that's another issue that can definitely be a challenge when people are trying to conceive, and something that people are often really hesitant to bring up to us, but is also quite common, right?
It is. We definitely see premature ejaculation very, very commonly. And there are some great guidelines and research in this area and treatments. Absolutely.
What are the treatments typically? What do people usually do? Is that also a combination of like relaxation therapy techniques and medications, or one more than the other?
Yeah, and you got it all. You got this side of things. The first line again is behavioral therapy. So learning different types of strategies during the act of intimacy, including things like
beyond just the Austin Powers, Margaret Thatcher naked on a cold day. There are other techniques, right?
Oh my gosh, that movie is fantastic. Oh my gosh, so many urology references.
Yeah, I was just going to say, one of I think it might have been on the podcast, you mentioned Austin Powers.
I think I did. Yeah, I know. It was my teen years, man. Those were the movies. We watched them way too much.
For sure.
That also showed a very impressive stream, though. Remember, he urinates for what is well outside the norm after coming out of cryogenic. So
I
don't expect your stream to be like that either.
Yeah, I did watch that movie recently, and it's got a lot of urology content.
It really does.
So. There are so many resources online, and in terms of seeing a sex therapist, that's probably the best bet for very tailored, specific conversations around it. And these are professionals, these are folks who are really, really good at talking about this, have really a firm understanding of the topic and strategies that people can use to improve their sexual function. So, I see a lot of folks being scared to talk with a sex therapist or reluctant, and I wish there was less reluctance, because it's really only for your benefit. There are some medications for premature ejaculation. Some of them, the main one is over the counter. So it's a topical spray. I don't know if I can use brand names here, but it is sort of the FDA approved medication spray. That's called Promescent, and what it does is it reduces sensation of the penis. So it's a numbing spray, and that's sort of first line therapy along with the behavioral modification. More advanced therapies are oral medications that are typically used as antidepressants, but what they do is sort of alter the serotonin balance in the body that helps sort of maintain the erection longer.
And similarly from that, part of the reason it's so important sometimes to see a urologist is a deep review of medications is really important, because sometimes people who are having issues with maintaining an erection or having an ejaculation, it could be related to being on certain antidepressants or other medications that you're on. And so part of that assessment is always figuring out what are you on? What are you on it? Is that potentially having a side effect that we could maybe change you to something different? So there are a lot of options for pretty much all of these issues. And I think when people come to see us, they're often so fixated on the goal of pregnancy, because that's sort of what brought them here in the first place. And I like to explain that we can be going at two different goals at the same time, because sometimes people go straight to doing inseminations for treatment. If they're having a hard time having intercourse around the time of ovulation, sometimes doing an IUI or an insemination to just take sex even off the table. On the day that you're ovulating, you can come in, you give us a sample. We know that sample is going up into the uterus, giving you that chance of pregnancy. That can be really helpful to just kind of take the stress of the process off, and that might help us achieve our goal of pregnancy. But in the long-term health of the relationship, we want people people to also have a satisfying sex life that they both are comfortable with. And so you don't want to just brush aside these issues because you're bypassing it with insemination. These are things that can really be quite treatable and can hopefully give you more of a healthy long-term sex life that fulfills what both of you might be seeking in that relationship.
I love the way you put that, Anne. I couldn't have said it better myself. Absolutely true.
And then going back to, that initial visit, let's say I referred somebody to you because they've had one or two abnormal semen analysis. And you kind of briefly mentioned, some testing and ultrasonography of the testicles to kind of figure out if there's anything going on. What are you looking for in that initial evaluation?
In terms of the ultrasound?
Ultrasound and blood work, I would say.
Oh, yeah, sure. So let's talk about the ultrasound first. So in the ultrasound, there are basically two things that we're really looking out for. One is a really important thing, which is a testicular mass. We know that testicular cancer is a cause of male infertility. So that's why it's also critically important that the testicle owner gets evaluated so we can rule out a mass using an ultrasound. The second thing that's really important that we usually are looking for is a structure called a varicocele, and that is a varicose vein around the testicle or adjacent to the testicle. Veins are the blood supply going from the testicle back to the heart, and a varicose vein around that means that blood is sort of falling down with gravity, and that can impact fertility. That can impact sperm production and sperm function. So varicoceles are something that we see in about a third of testicle owners coming in with fertility, subfertility. So very, very common finding and something that we can fix and that may improve fertility. So those are the main things we're looking at on an ultrasound. Other things that are important are just testicular size, making sure that things are, consistency looks normal. But those would be the main things that we're looking for. In terms of the blood tests or labs, that usually is a full panel of testosterone, those two pituitary hormones that I mentioned, the FSH and the LH, which are also getting tested in on the ovary side of things. And they're actually named after ovaries, ovary structures or cycles, but they are the same hormones on the opposite side, on the testicle side. So we look at that. We look at estradiol levels and one other pituitary hormone in general. That's sort of the summary of that advanced testing. We do occasionally look at genetics. If we see significantly low sperm counts, that would be a signal to do some genetic testing. And that usually includes two tests. One is the karyotype, which looks at the full complement of chromosomes, looking at the number of chromosomes, the structure, whether there are any significant deletions or pieces missing off of the chromosomes or inversions that can impact fertility. And then there's another genetic test called a Y chromosome microdeletion study. And that's looking at a very specific region of the Y chromosome that makes the genes for sperm production and looking for small little deletions. And those tests aren't indicated in everybody, just folks with low sperm counts.
And I think that's one of the things that people are often surprised by. If you have a semen analysis where we might see very low or even no sperm, it doesn't mean there couldn't potentially still be sperm being produced in the testicles, but just in such a small quantity that it's not coming out in an ejaculation. And in the world of fertility treatment, there is a vast difference between truly having no access to sperm and having the ability to get some small amount of room for the testicles in terms of whether you do have the options to try and conceive a biological child. And that's where some of that other testing, as well as some of the more complicated surgical mapping procedures you do, kind of let us know, is there a possibility to still conceive using your genetics?
Absolutely. Semen analysis may show zero sperm and there may still be sperm being produced. So it's definitely worth seeing someone with advanced fertility training like me or one of my partners. I definitely recommend that.
Yeah, so that brings up a good point too, is all urologists might not specialize in fertility. So you may have a urologist for some other issue or concern, but they might not be the right person for you if it's on the fertility side of things.
Exactly, exactly. Most urologists have a general training in, some fertility, but it's definitely worth seeing someone who has specialty training and who may know how to talk about these things, how to interpret tests like this, and certainly how to perform advanced study and surgery for fertility.
And I know today we're more just hitting the high points and overview, but I would love to have you back and do more of a, talking more about the surgical aspects. I think it's amazing. I mean, all the microsurgery things that we're doing now. So I think that would be really cool to do more of a deep dive into what is becoming kind of the next frontier of reproductive medicine.
And vasectomy reversal too,
Oh, yeah. These are some of my favorite topics, you guys.
These are a few of your favorite things. Sperm and vasectomies.
Oh no, now we have another song.
We're not going to sing today. No.
We're not going to sing today.
Gosh, Ruby, is there anything else we should mention?
I mean, really, I think we covered so much. I think we really covered all the things that I really wanted to talk about. The biggest thing I think the takeaway for people is, to make sure you're talking to your urologist, or if you are seeing somebody for fertility and you're having issues with sexual dysfunction, to bring it up. I know that happens a lot for us on the reproductive endocrinology side, where we'll do a new patient visit and we might just see the partner, in this case, the partner with the ovaries, and they might not bring up the issue of sexual dysfunction, or it comes up later.
Like, yeah, it's we not have this usually something plan. I hear in the first visit. It's usually like my follow-up when we've been doing things for about 3 months and someone's still not pregnant, and then maybe they mention, well, we have been, having intercourse, but it's getting a little challenging, and sometimes I feel like you kind of do have to build a little bit of that trust and rapport sometimes before people begin to be a little bit more open about what's going on, which is too bad because again, it's so common and it's not nerve-wracking for us to talk about it at all. We are
I just get right in there. You guys, I just get right in there.
Yeah. There's a lot of shame surrounding it, unfortunately. But if you are seeing a reproductive endocrinologist or a reproductive urologist, and just don't feel that with us, because this is our job. This is what we talk about all day long. Literally, we talk about all day long. So it's completely normal for us, and we're here to help.
Exactly. That's the main piece, is that we're here to help. And this should be, it's a holistic view of sexuality and fertility. So that's a part of it. And don't be afraid to share that side of things if you're having trouble.
Perfect. Any other final tips you want to pass on to listeners if we're trying to maximize sperm health and quality? I think we've covered kind of most of the high points.
Yeah, I think it's just, it takes two to tango. We got to look at both sides. And I really, really appreciate this podcast for shedding light on what is a very important element to the fertility journey. So thank you both for the invitation. And I love working with you. And I look forward to being back anytime.
All right. Thanks so much, Marah.
Marah, you're the absolute best. Thank you so much.
Thank you both so much.
Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review the Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.